Hi, I'm Nicole Webb Bodie, partner at Healthcare Plus Solutions Group. I had the pleasure to sit down with Quint Studer, our co-founder, for an insightful look back at the history of what has become the focus for so many organizations in the industry: experience and engagement. Whether you've known Quint, worked with him, read his books, or even heard him speak, you undoubtedly know he has been called one of the best friends to healthcare. If you don't know Quint, you likely know and use many of the tools that he created and implemented at healthcare organizations across the country. Please enjoy this short clip from our conversation. To watch the full video, you can visit our website and our learning library at www.healthcareplus.sg.com.
Well, I think early learning, when you look at it, I didn't even know what it really was per se. I got this job at Holy Cross Hospital. I was really excited about it, and very excited. Mark Clement, who was the CEO, and I had really had good synergy. And basically, when he hired me, it was really to look at the physician, managed care contracting, and so on. We didn't talk when I interviewed about patient satisfaction. And it's been different things. It's been patient satisfaction, then service excellence. We had department service, then it became patient experience. Now it's sort of morphed into human experience. So things move. It really doesn't matter what you call it. What matters is what you behave, how you do it. So Mark was really ahead of his time. Mark, when he came to Holy Cross Hospital, educated me, because I was 42 years old or something like that. And I got this job. I'm really excited about it. And he'd gone to a conference and his last job and really gotten to know somebody called Clay Sherman, who wrote a book, The New American Hospital. And he had hired Clay to come in and work with us as a consultant. And Clay had some very specific things. And one of the things is he had these things that were sort of pillars. There were service, quality, and he called it cost, and people. And as we sat there, he had a whole toolkit on how to implement it. And we just, when you're a hospital that struggles financially, you have a very small senior executive team. So we had somebody in human resources, we had somebody in finance, somebody in nursing or quality at the time, that was quality, and I was the odd person out. So we had these 4 pillars and we had 4 people, but the obvious 3 would go to quality, cost, and people. So Mark looked at me and said, "Quint, you're in charge of service." So again, I'm a special ed teacher by trade. And when you're a special ed teacher, and I have a bachelor's and master's in really behavioral education, you start and you learn, you diagnose. So I've always leaned toward diagnose before you treat. And I'm curious. So once Mark assigned me it, while I could read something in Clay's book about it, I decided to really dig in deep and really sort of understand what is this patient satisfaction that now I'm in charge of moving from single digits way up.
So tell me about what was your journey to learn and what your next steps should be.
Yeah, well, again, we had teams. So one of the things that was suggested, you have a measurement team, and that's a team that looks over the data. You should have a reward and recognition team to recognize performance. You should have an inpatient team, an outpatient team, a physician team, an emergency. You have these teams. And the big team was the measurement team. So if I'm being held accountable to move a percentile, at the time the goal was sort of, I understood now how big, hairy, audacious goals before James Collins, we were below the 10th percentile. And Mark just said, well, we don't want to be average, we need to be above average, and 75th percentile was above average. We had no idea how hard this was going to be. When we finally learned, they said, we don't think you can do it. So I wanted to understand the tool, because I think you have to understand the tool. How are we being measured? So I got my car and I drove down to meet with Erwin Press and Rod Gainey. Both of them were PhDs at Notre Dame. This was really much born out of Notre Dame University. They were an accountant, Rod Gainey, and an anthropologist, Erwin Press. So they were interested, Erwin was particularly, on how was the changes in the payment systems going through over the years going to impact the experience of a patient. So like many companies are born out of studies in a university setting. So Erwin Press and Rod Gainey, first they were very excited because they said it was very unusual for them to have a senior executive show up in South Bend. So they walked me through how the questions were formed. They walk through, some are more important than others, and that's sort of how I sort of learned the tool. What were the most important aspects for the patient? How many responses you need to have a valid and reliable tool. And when I started them with Irwin and Rod, I mean, it was a very small little company here. And in fact, we only got reports quarterly, which then actually at Holy Cross, we started saying we can't wait quarterly, and those will probably gasp. But at the time, you basically sent out the surveys, they came back to your hospital, you bundled them up and you sent them to Rod and Irwin. And they had people that calculated them. And basically, that's how you knew how you were doing. And then they put it on a percentile compared to the hospitals in your database, all of them then. There were not that many. And so we started saying, well, we don't want to wait a quarter, so let's do it monthly. And then it was weekly. And it was really neat because then we saw Irwin and Rod adjusted as we were adjusting to make it more, I think, more actionable. Because before, people would get the results and they'd sort of look at it, but it was old. It was old. So we really, really worked in partnership with Rod and Irwin because they loved us because we were a lab. And we became so serious about it. So they would send hospitals to us all the time, so for us to show how to utilize the tool, because while they could do it in South Bend, I think they liked the fact that a hospital actually doing it could show them how to do it.
And you've had great success at Holy Cross. Talk a little bit about that success and then how you took what you learned at Holy Cross to go to Baptist Hospital.
Yeah, we didn't know we would, but we basically started and, we wiggled, and we had all the excuses, of course, that these are, rough neighborhood. We had no private rooms. Everything was a semi-private rooms. In fact, our OB unit, they could have shot a movie there because it was actually like 10 women in one giant room. So it was an old hospital. And we didn't, we just started doing the things, and certainly it started moving. And then all of a sudden one day we hit 40th percentile. We had this big celebration. And then we hit 60, we had another celebration. And then we hit 75, we were just stunned. And in less than a year, we hit the 92nd percentile, which got a lot of attention. The Chicago Sun-Times ran a little article on this little hospital that could. But as we learned, we learned along the way, because one likes to diagnose, but then I like to document what's working and what isn't working. So we got a lot of attention, and then Rod and Irwin asked me to speak at their conference. So I spoke at their conference in a breakout, and in the breakout, I created so much more material than you need. I had never done this before. I mean, I was an operator. So I just did a breakout, and back then they had a little cassette. You could buy cassettes when you left of all the speakers, and people started listening to my tapes and started showing up at Holy Cross Hospital. So we got to know them. And then all of a sudden, because we were showing it was working, more hospitals liked it because now they knew that they could do something with it. And we started showing data, research that showed, all sorts of good clinical information, because we wanted to show that this was more than, this wasn't a nice to have smile. This is just basing it, integrating into general operations. So one of the hospitals that came and visited was Baptist in from Pensacola, Florida.